four, three. Isabel.
Good morning and welcome everyone to the Coalition of Orange County Community Health Centers Coffee Connections event. We're thrilled to have you here today virtually on Zoom and through Facebook Live. My name is Isabel Becerra, President and CEO of the Coalition of Orange County Community Health Centers, and I will be your host and moderator for the event. For those of you who are new to our Coffee Connection events, welcome. These gatherings are crafted to foster unity, connection, and education among a diverse array of participants, including health center staff, community-based, academic, governmental partners, coalition staff, policymakers, and other stakeholders. Our aim is to spark meaningful dialogue and drive collective action on critical healthcare and public health topics that directly affect the communities of Orange County. Through these events, the Coalition strives to create a platform in which we have a shared understanding and common language, as well as a space for continued collaboration to further drive action towards a healthier Orange County. And for those of you who have joined us before, welcome back. Your continued participation and engagement in our Coffee Connection events are invaluable. Together, we're building a stronger network, deepening our understanding of key issues, and forging pathways for positive change within the Orange County communities. Thank you so much for your ongoing support and dedication. Today's event marks the beginning of our Coffee Connection series for 2024, and we couldn't be more excited to kick it off with such an important topic. Truth matters, mobilizing and building resilience against misinformation. As many of you know, the Coalition of Orange County Community Health Centers is a membership organization that represents the interests of the health centers that serve our community's most vulnerable patients, those who are either uninsured or underinsured and face disproportionate risks due to the structural racism and discrimination. April 24, 2024 marks the Coalition's 50th anniversary, 50 years through which the Coalition has engaged in the work of building a healthier Orange County. We believe that for our community to thrive, everyone must have equitable access to quality, affordable healthcare, regardless of income, ethnicity, or immigration status. As such, raising awareness, providing education and training, serving as trusted sources of information for both our members and our communities, mobilizing patients, providers, stakeholders, and community, and facilitating thoughtful and often uncomfortable conversations to enable change is integral to the work of the Coalition. As we think about our path forward for the next 50 years, we hope to continue championing equitable access to healthcare while also expanding our focus to address emerging challenges such as combating and bolstering resilience against misinformation in an effort to continue advancing the health and well-being of all residents in Orange County. Today's discussion on Truth Matters is just the beginning of our commitment to mobilizing and building resilience against misinformation, and we invite each of you to join us on this journey towards a healthier, more informed future. In an era where misinformation proliferates, it's essential to understand its impact and how we can combat it effectively. The spread of misinformation can have far-reaching consequences, affecting everyone from public health to democratic processes and how fair our elections are. By addressing this issue head-on, we can work towards creating a more informed and resilient community. More specifically, with 2024 being an election year and the primary elections just 5 days away, slated for Tuesday, March 5th, the urgency of this discussion cannot be overstated. The stakes are incredibly high as our collective health and well-being are deeply intertwined with the outcomes of these elections. As we delve into today's discussion, we encourage open dialogue and sharing of insights via chat, fostering collaboration among us. Together, we will explore strategies to promote truth and combat falsehoods in our communities and beyond. And before we jump into today's vital discussion, let's cover some housekeeping guidelines. Please keep things professional and respectful. Let's steer clear of anything offensive, discriminatory, or disruptive. Feel free to dive into the conversation, ask questions, and share your insights. We thrive on diverse perspectives and constructive dialogue. If you have a question, please use the designated Q&A feature. This helps us keep things organized and ensures everyone's questions get addressed efficiently. We're committed to fostering a safe environment for all. Any comments or questions that are deemed inappropriate, offensive, or unrelated to the topic at hand will be dealt with immediately. We'll remove any inappropriate or off-topic content and, if necessary, take further action including removing the participant from the event if necessary. We value your input. After the event, we'll provide a short evaluation form so you can share your thoughts and suggestions for future Coffee Connection events. Thank you for your cooperation in making this event a success. All right, let's kick off our event, starting with our keynote speaker. I am absolutely delighted to introduce today's keynote speaker, none other than Dr. Regina Chinzio Kwan, or as we affectionately call her, Dr. CK. Dr. CK currently holds the esteemed position of County Public Health Officer and Chief of Public Health Services at the Orange County Healthcare Agency. Since joining in November 2020 amidst the COVID pandemic, she's been instrumental in the planning and execution of Orange County's vaccination efforts, showcasing her unwavering dedication to public health. With her leadership, Dr. CK continues to drive engagement with the medical community, enhancing awareness of the agency's initiatives and programs. A board-certified family physician, Dr. CK earned her medical degree in osteopathic medicine from Western University. Prior to her pivotal role in public health, she served as a primary care physician in Orange County and held the position of medical director for innovative wellness clinics and urgent care clinics. Her journey also includes service as a Navy family physician, completing her residency training at Naval Hospital Camp Pendleton. We are thrilled to have Dr. CK join us today to share her story as it relates to misinformation. And Dr. CK, the stage is all yours.
Thank you so much. So let me try to get my screen shared. The Zoom is saying my host disable participant screen sharing. It's not allowing me to share my screen. So as we figure that out, good morning, everyone. Thank you so much for inviting me to speak on this very, very important topic. I'm really honored to be here and humbled to even be the guest speaker for this topic. During this presentation, I intend to review some of the definitions of misinformation and go over some of the impacts and also review potential solutions. Okay, let me see if I can share now. Nope. Okay, hold on one more time. Okay, I think I'm there. I'm going to make sure this is on slideshow. Okay, is that on? Hold on, technical issues. Tavio, I think I'm gonna have to let you drive. I'm gonna stop sharing.
It looks great, Dr. CK.
My
Good.
problem is on my end. I'm already having issues with my computer. Hold
Got
on.
it. We'll put your slides up. Just let us know when you want to advance.
Stop share. Okay, hold on. Technical issues.
And your slides are up if you want to start.
Okay, my whole screen is. I don't know what to do.
Go ahead and start, Dr. CK. We'll advance your slides for you.
Okay, so thank you again for inviting me. With COVID, it was an interesting time, right? It was a time where there was a lot of high emotion, a lot of fear, and we were in an information age that we have not experienced in the past. Go to the second slide. Prior to this time, people received information from things outside of social media. Maybe it was a telephone, maybe it was a newspaper, then it expanded to radio stations, TV. But when you look at the 2000s, we had internet, we had wide range of information, and we would have expected that in a pandemic situation with this access to information that we would be able to really go further in protecting the community when a pandemic occurred. And unfortunately, we were actually fighting two battles, right? We were fighting the information age in an infodemic and also the COVID pandemic. And we were fighting a lot of social media where information spread even faster than the virus itself. So just want to take you back in time. And if you remember in 2020, it was a very rough time. You can go on to the next slide. I can't see what's presented right now, so I'm so sorry. So So in the image, you'll see, I mean, it was a tough time. People were really upset about lockdowns. People didn't know what to do. They were fearful, and there was a lot of things going online. There was a lot of Twitter, Facebook, uh, and Instagram, and all those other social media aspects. And I don't know if any of you have watched the movie Death to 2020. If you haven't, you may want to consider watching it because it kind of it's a parody on what we experience as a nation and globally with the pandemic. And it really shows you the negative impacts of misinformation and how people, unfortunately, even if they didn't believe the misinformation, unfortunately, they were negatively impacted to even utilize that information to make decisions. So it's really important for us to understand that historical piece and what we just lived through over the last 4 years. So I encourage you all, again, to try to watch that if you haven't been able to watch it. Okay. So on the next slide, you'll see our Surgeon General, Dr. Vivek Murthy, actually did realize the significance of misinformation. And in 2021, he published an advisory on building a healthy information environment. And he was urging all Americans to help slow the spread of health and misinformation during COVID pandemic and beyond. And I think we all realized how serious of a threat misinformation was to public health because it really caused a whole lot of confusion, a lot of distrust in and mistrust in science, in medicine, and in government, and really put us all at risk. And as you know, billions of dollars were spent to try to fight COVID, but as well, we had to fight many other challenges we were facing at the time and continue to face today. And it really takes everyone to fight against misinformation. So the next slide you'll see here is definitions. And, definition of misinformation, disinformation, malinformation has changed, and it will probably continue to change. But for the most part, misinformation, as we're going to explain here, is untrue or false connections, or maybe misleading or inaccurate. The sharer may not even be aware that what they're sharing is misinformation because there might be some falsehood about what they're saying. And really, misinformation from this perspective, really, there was no political aim. But disinformation is part of misinformation in that there can be false context, it can be manipulated content, and it can be put out to deceive and influence. And then you have malinformation. And this is where people are trying to hack, leak information out to really influence and cause, and it could be hate speech, it could be harassment. So again, there is some intersection here with information, but at the end of the day, whether there was no political aim or political aim, it negatively affects everyone. And the Surgeon General went on to say that in his advisory that it may change, right? The definition is going to change because we're going to have different scientific knowledge as we research the virus. So here he says misinformation can sometimes be spread intentionally to serve a malicious purpose. And it's sometimes to trick people into believing something for financial gain or political advantage. And that's usually called disinformation. But I do like this next statement. Many people who share the misinformation aren't trying to misinform. They many times have really good intention, but they may be just raising a concern. They're trying to make sense of the information. They're seeking answers to honest questions. And sometimes they don't even realize that maybe there was something in what they said that they thought was true. But unfortunately, maybe there was something that actually wasn't. So there really wasn't any intention. And the impacts of misinformation are broad, right? When there is misinformation, especially during the COVID pandemic, what we saw was people were hesitant about vaccines. They still had questions or they just dismissed it altogether. They may have reduced their adherence to preventive measures that could have been followed to reduce their risk. They may have utilized unproven treatments. A little bit of background about me before joining the agency. I am a family physician, and I did do extra training to look into integrative medicine because I did like the holistic side of medicine. So I actually really studied that and also practiced and provided options for my patients. And during 2020, when we had COVID, I was advocating for really understanding vaccines and really, trying to encourage people to really take care of themselves and be mindful. But with that, I received a lot of patients who really dismissed COVID pandemic. So I dealt with a lot of people who didn't trust vaccines, and they had their reasons. So I was just trying to encourage them to have more information. But it became apparent that year in 2020 that more had to be done. I wanted my patients to really be prepared that when a vaccine was available, that hopefully they would really accept the vaccine and find ways to be able to receive the vaccine, because COVID, really from an integrated perspective too, was really harmful. We saw it was the first time I saw an infection that really caused significant inflammatory markers to really rise beyond what I've ever seen in practice. And as an integrated practitioner, looking at cholesterol, inflammatory markers, and trying to do my best to get patients healthy, I was trying to tell all my patients they needed to avoid COVID if at all possible. And that meant they had to believe in the preventive measures of the time. And with the unproven treatments, I was being requested to prescribe ivermectin and hydroxychloroquine, and there was no evidence, and I could not recommend it. So it really was during 2020 when I saw how many people really dismissed COVID altogether. And I was actually just trying to find a solution for my patients to get better testing ability. That I actually saw that the county was having their first time with opening their testing centers, and found an opportunity to see what was going on at the county. And that's when kind of opened my eyes that maybe I should do something more than just see patients one-on-one, that I probably need to make a stand against COVID more broadly. And that meant helping out with public health. So luckily, I was helping out with trying to resurrect all those vaccine sites, and really happy that I joined the county to reach a broader level of patients and encourage more people to really have faith and trust in the science, in medicine, and in vaccines. We know that there was a significant burden on our governments, our healthcare systems, and public health. There was a lot of violence that even goes on today. From then, there was a lot of people who were shouting a lot of hate speech. And there were a lot of also, I don't know about you, but their friends, family, and even neighbors who people were pitting each other against their beliefs of whether COVID really was a thing or not, or whether to follow preventive measures or a vaccine. And when you chose to do one, sometimes I felt like it was held against you. There's a lot of stigma, and there was targeting, and it broke up families. And this is costly because unfortunately we became more of a disconnected society. You can see the polarity that we're all now experiencing. And I'm hoping that we can all recover and come together to find better solutions. The bill you see here on the left, I was trying to find numbers to see, was there something that can show you the numbers of the cost of misinformation? Unfortunately, that was difficult. What you're seeing on the left here is actually Canada did a study in 2021, and this was their estimate for, I think it was a 9-month period of time, to show their population what the cost was of misinformation. And the impacts are significant, right? We're still dealing with the negative impacts. It affected patients, families, communities negatively. It causes a lot of disruption in the care system, and a significant economic strain. We had a reduction in public trust, science communication, and cross-sector relationships. But I'm hoping, again, that we work on rebuilding those three, because this is really what's going to determine our success for any future outbreaks and pandemics. So how was the nation impacted with vaccinations? New York Times in 2021 published this this table, and I think it really demonstrates the importance of vaccines. You see here when vaccines started in December 2020, and then you see in March 2021, after 100 million doses were administered nationwide, we see a reduction finally of the deaths related to COVID. And then you see that on the graph on the bottom that the rolling average of deaths with and without vaccination. So green is those who are vaccinated, and then red, those without vaccine. So obviously there was a positive impact of saving lives with vaccination. Now, on the colored portion, you'll see here in the middle, the vaccination rate in 2021 for Orange County. So we had difficulty with the Hispanic Latino population as well as our Black population. And we know that there are there are a lot of historical reasons for people to have mistrust, and we need to do a whole lot of work to really educate those communities in a culturally sensitive way. And this is where we partnered with our community-based organizations to really do that hard work. So you see here, January through December 2020, we lost over 2,800 lives to COVID. And this is when we didn't have the vaccine. Then you see in the beginning from actually December through probably around March period, right? The effect of vaccines, where we have a reduction of deaths, and then finally you see the result in July and the impact July through December, the second half of 2021, when a good portion of our community was vaccinated. You see a significant reduction in deaths. On the tables below, you'll see hospitalizations related to vaccination status as well as deaths related to vaccination status. And you see there in the course of that year, those who were not fully vaccinated really had the higher levels of hospitalizations and death rates. So vaccines really do save lives. And I invite you all, if you have not already, to go to our website, Equity and OC, because there's a lot of great information. You know, we wanted to make sure that the information was pertinent to the communities, especially those who are most vulnerable and most impacted by the pandemic. You see here for the Hispanic Latino community, there's a significant death rate as a result from COVID, and as well as our Asian community. There were certain groups where we didn't have enough data, and it proved to us that we need to look more into those groups to help them with their data, and that was the Black community. Again, this is all available to you. We will provide the slides to you if you'd like to peruse them at your own time. And this statement is even more concerning, right? So I would think that if I saw misinformation, that I would, know that it's misinformation, and I would not act on it. It would not affect anything that I do. But unfortunately, that research that has been going on even before the pandemic proves that, here, as what Dr. Lewandowski said, the fundamental problem with misinformation is that once people have heard it, they tend to believe and act on it, even after it's been corrected, and also even after you yourself may have dismissed it. Unfortunately, it still impacts you because if it's readily available or if it's been repeated multiple times, sometimes you may actually navigate towards actually believing it or behaving in a way that actually supports it. So it is very dangerous and unfortunately has significant negative impacts. And when I looked further into, well, how do people even decide if a statement is true? Unfortunately, we take shortcuts. It's easier to not validate. We don't have the time, and in an age when information is everywhere, you look at these 5 things according to Dr. Schwartz. You look at, okay, is this information compatible with other known information? Is the source credible in your eyes? So everybody has different ideas of what's credible. And then if it's believed by others, you're more likely to validate that as true. And then when you look at the information and the context it's presented in, if it's at least it looks consistent, you're more likely to say it's true. And then whether or not there's supporting evidence, but again, most of the time people just shortcut If they feel like it's information from a credible source, it may still be wrong and you're going to trust it. And then, of course, if it's in the circles that you're with, you can already have a bias. And then, but if it's believed by others in that circle that you believe in, then you're more likely to believe it's true. So we have to understand the psychology of how people validate the information that they are being presented to even counter misinformation. So what can be done? There's a lot we can do, right? We can learn about the other side, learn also about whatever the challenges that we're facing, engage in communication and partnerships and discussions, and then address misinformation, especially when it happens. But we have to be careful and mindful. When you respond to those who believe in misinformation, you have to engage respectfully. There are different tools, and at the end of this PowerPoint, there are resources that are provided. You have to listen with empathy and ask questions, because otherwise, if any of that is not followed at the first onset of the discussion, likely you will lose whoever you're trying to talk to. Connect with common values. You know, as clinicians, typically we want to go to logic and try to use logic to get someone to understand or try to understand what you're trying to say. But at the end of the day, that actually can counter you. If you use logic first, especially for someone who may have different beliefs than you on a sort of information, you actually lose them at hello. So the Surgeon General actually put out on his website about misinformation a lot of tools of how to really connect and help someone who is swayed by misinformation. And I'll go over that on the next slide. But the primary things to think about is listening, empathizing, and then just point to credible sources. Don't shame. Use inclusive language, and know that it's going to take many conversations. You may not have that person understand you or believe what you're trying to tell them at the first time. And I'll give you a story. So 2021, it was tough. I was in an area where a lot of people had a lot of questions, didn't understand it. And it really took multiple engagements for people to finally trust the information I was trying to present. Trust that, yes, COVID was a thing, that preventive measures do work, but it took many, many engagements and many times, and sometimes also just wearing the mask and following all the preventive measures on a regular basis also helped, right? Because they saw I was not getting sick. So there's so many things that we can do to really help people when they are believing some of the misinformation. Health systems have their part, and we have learned that it's easier for our healthcare providers to immediately answer the questions that patients have and their concerns. And if there is already a good relationship, even a simple message of, hey, I really believe this vaccine will work, actually goes a long way with providers. But once things become misinformation, disinformation, and are on social media, that's really hard to influence. And so this is where it takes all of us to help out on that front. I'm going to keep moving on. You could just look at the scenario side. So this is from the Surgeon General, and it gives you this very specific tips on when talking to someone, how to approach them. Listen to their fears, focus on how they feel, and find ways to connect with them to show that you understand their feelings and you're hearing them. Empathize, ask questions, admission to your own struggle with certain feelings, and then give some potential alternatives. Have you thought about this website or this information? But don't push the topic, just ask and point to those credible sources. And then try not to shame. There's so many ways that people are shaming without even realizing it, but do your best to just be empathetic and more curious, and use inclusive language. Show that you're also struggling, and you're there to continue on with the conversation or answer any questions. I think this has gone a long way. It helped me through 2020 and beyond. And I think it's a great tool for everyone in public settings or even in private conversations. Other ways we can stop the spread. We have a lot of work to do right now, preventing the spread, avoiding the repeating of the misinformation. If we do absolutely have to restate the misinformation, then we want to do a truth sandwich where you say one truth, whether it's scientific truth, and then you sandwich it with, okay, so here's this misinformation statement, but then you can also provide maybe some scientific information that invalidates that, and then go back to a truth statement. So that that's one way of debunking misinformation. Increase health literacy in our population and amongst the communities you work with. Build on partnerships, because really partnerships and relationships go the longest way. I had the difficult time of trying to connect with relatives, trying to encourage them to understand COVID and the importance of getting vaccine. And it took a lot of time. At the end, after giving all the information about the scientific, trying to debunk, trying to give logic, trying to look at all the different research that they were pointing to as this is not a pandemic, it's not a thing, or they didn't believe in the vaccine, they thought it was harmful. I tried to counter everything, even with all of my scientific knowledge, even with my integrative knowledge. I tried to disprove it. At the end of the day, the person who I was trying to encourage, at the end of the day, she said, well, it actually was not even all the evidence you gave me that encouraged me to believe and encouraged me to seek the vaccine. It was because you cared. It was the relationship side. I could see how much you cared about me and that you were doing everything and anything you could to help me understand, but not shame me when I was providing you all this information. So she showed me how important that relationship was, and how when we discuss things, it's so important to continue to build on that relationship and not dismiss the other person for their concerns. There's a term called pre-bunking where we can, what we call inoculate against information, show people, hey, this is misinformation and here's why. And so if we give that information in small segments, but also give ways to counter it, then that's where we can actually protect. So when people are seeing the misinformation in the future, they wouldn't be so likely to trust it, or they will recognize it as misinformation and not be influenced by it. Debunking any misinformation and then continuous engagement. And that is all I have. And I'm sorry I can't see all of you because my computer is a little bit not working with me. Thank you.
Well, thank you so much, Dr. CK, for sharing your invaluable insights and expertise with us today. Your dedication to public health and commitment to improving the well-being of our community is truly inspiring. Again, thank you for a fantastic keynote address. Now, as we move on with our event, we have an exciting lineup for our coffee chat segment. So without further ado, let's begin our moderated discussion. And so I'd like to give our panelists a few minutes to introduce themselves before we begin. We will start with Dr. Adrienne Martinez Hollingsworth, and then Julie McDonald, and then Dr. Sue Ellen Hoffer. Go ahead, Dr. Adrienne. Thank you.
Oh, hi, everyone. So you can hear me okay, I assume?
Yes.
Modern technology, we always want to make sure. But hello, all. I'm excited to be here. My name is Dr. Adrienne Martinez Hollingsworth. I am a nurse by training, but I am also an academic researcher who explores basically what are the barriers to chronic illness uptake strategies. So a lot about how do patients and providers interact, and in many ways, how we address misinformation and disinformation. I am currently the Director of Research and Evaluation here at Ultimate.
Thank you. Okay, Julie?
Hi, good morning. My name is Julie McDonald. I'm the Communications Director at the Orange County Healthcare Agency, and came from many, many years in the private sector in marketing and communications, primarily in retail and in business to business, and had no idea what I was signing up for when I came to the healthcare agency before COVID hit, what we were going to go through over the last few years. It's been a tremendous learning experience, and I'm excited to be here to share a little bit of that with you guys today.
Thank you. And last but not least, Dr. Hoffer.
Hi, everyone. Yeah, great to be part of this conversation. And I am Sue Ellen Hopfer, Associate Professor of Public Health and the Department of Health, Society, and Behavior at University of California, Irvine. So coming from an academic institution and involved in, from a public health communication research angle, to understand around vaccine communication. And that really shifted and ramped up during the pandemic to understand online exchange of information. And I'll share more about that. But yeah, I think that's my background. Yeah, and I guess just that I am board certified in medical genetics, and then have an educational background in communication also.
Thank you so much, Dr. Hoffer, and thank you everyone for introducing yourselves. And also, before we start in our first question, we are dropping into the chat resources from Dr. Hoffer. So speaking of, so Dr. Hoffer, the first question is for you. From a research perspective, what are some key insights into the spread and the impact of health-related misinformation? Are there any emerging trends or patterns in the dissemination of health-related misinformation that you find particularly concerning?
Great question. And I'm going to open it up that this is an ongoing area, active area of research, and that we really need to focus on enhancing surveillance of online misinformation to understand the cycle. So it's kind of 5 areas where there's ongoing research, understanding the psychological drivers, assessing the real world consequences. So there is a lot of different kinds of misinformation, even health information, and we care about that when it's consequential for adverse health outcomes like we've witnessed during the pandemic. So we do also want to focus our efforts on vulnerable populations and developing effective responses, both through public health officials and also in the clinical healthcare setting. So that's still ongoing. There is health misinformation across a number of areas. The most prevalent, I think, vaccines, but also tobacco products are up there pretty much as far as prevalence. It ranges depending on the platform, but between 30 and 40%. Again, it can really, there's quite a range depending on the platform, and things change over time. But there's also health misinformation. So I was asked to talk kind of globally. I do research around vaccine misinformation, but there is also health misinformation about diet. So kind of 6 areas: vaccines, drugs and tobacco products, diets and eating disorders, pandemics and communicable disease, non-communicable diseases, and medical treatments. So I just wanted to give kind of a broad picture of the range of health misinformation. And so all of these areas are concerning. I think developing tools to be able to rapidly monitor and it's predominantly, much of the misinformation is in online and social media settings. I think it may also happen in other media settings and in-person settings, but from a public health perspective, we can concentrate research efforts on monitoring, really with specific understanding the details of it, how it changes over time, what gets adopted or rejected will be valuable information for public health officials or clinicians to be able to act on that misinformation. And we know that when there are information voids, that can rapidly turn into that filling that void with misinformation. So ideally, we want to try to avoid that if we develop tools where we can predict the kinds of health misinformation coming down the pipeline. That might give us a little bit of time to be able to prepare and possibly inoculate what Dr. CK mentioned, give people warnings about misinformation coming down the pipeline would help, because once it's permeated and people have heard it, it's very difficult to undo that. So I don't know if I should stop there or it's to have a conversation.
No, that's great. Thank you. We actually have, let me keep going with your questions, given that with all that in mind, how can interdisciplinary collaboration between academia, healthcare providers, and communication professionals strengthen efforts to combat misinformation? And how can we adapt our strategies to stay ahead of evolving misinformation tactics?
Yes, another great question. And I'll just say, so I wanted to pull back and say, we need to really combat misinformation on multiple levels, ideally, if we have the resources. And the big picture are really technological approaches, whether that's changing algorithms, there's legal and policy approaches, then there's educational approaches and psychological approaches. So combating misinformation can be approached on multiple levels from multiple angles, from regulation and to education. And in my research area, I am focusing on the educational and psychological areas of understanding cognitive reception of information, and developing in collaboration with computational linguists, developing informatics tools that can rapidly, assess the detailed nature of, in my case, vaccine misinformation. Because we can't manually outpace the rapid dissemination of misinformation. So we're working on developing an informatics tool, and I think the interdisciplinary collaboration is also having these kinds of coffee connections across institutions, keeping that communication frequent, and joint efforts with also healthcare institutions to really approach misinformation on multiple fronts is a great way to begin tackling. It really is a complex, big beast of an animal, and we try to chip away at it from informatics tools, policy and regulation, and this frequent institution coordination and communication. That's kind of at a high level approach.
Yeah, thank you, Dr. Hopfer. I know that we are looking at it from level and thinking about, how do we strategize at the academic level with all the tools, resources that we have available to us. But sometimes that's not enough, right? Sometimes when you take it to the boots on the ground, if you will, we have to think about how does it impact the average patient or average individual that is being bombarded with this information. So I'm going to ask Dr. Martinez then to speak to that a little bit. And as a provider who has specifically focused in the past on behavioral and mental health, can you tell us how you navigated conversations with patients who were influenced by misinformation, especially when it pertains to their health decisions or treatment options?
Sure. I think when we're specifically talking about mental and behavioral health, and actually more specifically, we're talking about crises, which is where we see the primary impact of misinformation, disinformation. We're dealing with stigma, and we're dealing with why stigma exists as a protective mechanism. So let me kind of dig into that a little bit. Misinformation and disinformation exists along a timeline. And for our folks, I work specifically in Latino and African American communities. Things that are no longer true maybe were true at some point. And for example, when we do a lot of emergency evaluations for like a 5150, so an involuntary hold for danger to self or danger to others or grave disability, the reality is someone may be in an acute mental health crisis, but the family has memories of when calling for help, going to any governmental or justice involved kind of setting, means that the threat goes beyond that individual's mental crises. It means that you are inviting agencies into your home and into your family that might, for example, increase your risk of deportation, right? And so, or sometimes having your children taken away. I've seen that play out several times during the course of my clinical career. And while that's no longer true in many instances, it doesn't mean that that memory goes away. And so I like to look at misinformation at a more local impact and effect. I understand the social media and political speech has a major influence on how our folks uptake care. But at the same time, there are traditions that have existed for a long time in our communities that have served to protect us from, frankly, structural racism, structural divestment, structural oppression, that we have to actively untangle and challenge as providers. So I think from my perspective, getting to where we acknowledge that stigma, which prevents adequate care, exists for a reason and can be challenged and is an opportunity for the patients and also the providers to restructure how we want the care experience to go, really is grounded in us identifying where is this misinformation coming from, and is it malicious or was it potentially beneficial in previous eras, and maybe is no longer true, but we haven't jettisoned it yet because it's kept us safe.
Thank you for that. And now let's go a little deeper. How do cultural beliefs and values influence that reception and acceptance of health information within, the varying different communities that we are caring for? And can you share any experiences or examples of culturally sensitive approaches to combating the misinformation while respecting the diverse perspectives?
Yeah, absolutely. I mean, as a nurse and as a researcher, I've both focused on acute mental health and also diabetes. And interestingly, I'm also a first-gen Latina from East LA. And so I'm familiar with our sort of cultural connection between emotional distress and the belief that it generates chronic illness, things like hypertension and diabetes. Right. And so that awareness of what is susto for people who maybe you experience some sort of shock or trauma, which then resulted in a physical illness. As a provider, I've gone through the entire, chain of education that has convinced me, no, diabetes is grounded in sugar, resistance at the cellular level and how your pancreas interacts, et cetera, et cetera. But in reality, we're starting to understand and untangle how our emotional distress, epigenetic experiences, including, times of abundance and times of starvation, have sort of combined all of these different factors into the wholeness that we see as a healthy person or a person who is not achieving their optimal health. So when I think about misinformation, it's very tempting to go in and talk to a patient and I ask them, what are you doing for your diabetes? And they tell me, well, I put cinnamon in my coffee every morning. What? Right now, as a provider, I've been trained, there's 3 things we do for diabetes, right? We do exercise, we do healthy diet, we do medication compliance. And at no time did anybody ever tell me that cinnamon was part of that. And so the tendency to go in as a provider and assume that you are the foundation and repository of all Western knowledge when it comes to healthcare can make you sort of subconsciously invalidate all of these other indigenous ways of knowing that have kept people safe for centuries. In reality, frankly, cinnamon does activate GLUT4 receptor genes that help process insulin. We do know that. Now, are they as good as anti-hyperglycemics? No, but it doesn't mean that they don't work. right? And so I think as a provider, going into spaces where you understand that misinformation, disinformation exists along this timeline that encompasses humanity's experiences, right? So we're talking about today, we're talking about their grandparents, we're talking about 10,000 years ago. How can I be humble as a provider and not immediately out of hand disregard people's reality, their ways of knowing, when in fact, maybe they have some level of efficacy, when in fact, I personally as a provider can grow a little bit. And also, if we take this approach, we can see the care experience become a mutually beneficial space. Great for our patients, but also good for us as providers who are struggling post-pandemic to reconnect to the why are we even doing this? Right? There are so many challenges. How do I get back to a place where I am really enjoying providing care, receiving feedback? And I believe that that's sort of rooted in us being humble and being willing to listen to why people believe what they believe, whether it's wrong or not, no matter where they heard it from. I think there's a lot of potential for growth there for both parties. And I also think it's a real great transformative space for recovery post-pandemic.
Thank you. That's amazing. That's a great example of validating and respecting people's values and cultural beliefs and meeting them where they're at. Thank you. Okay, so Julie, in an era where information overload is common, how does your organization ensure that accurate health information cuts through the noise and reaches the intended audience? What role do targeted messaging and audience segmentation play in effective communication strategies?
Sorry, I had to unmute myself. There was some construction happening below me, so I was muted so that you didn't hear some drilling. Well, and apologize for that. And thank you for having me. I sure appreciate this opportunity, and what a great topic to talk about. As a communicator, I think the thing that we learned really loud and clear throughout the recent challenges, especially COVID, is that we can't do this alone. We can't individually be in this alone, because we're only effective to the individuals that actually trust us, right? And as a government agency, our audience can be polarized and tempered by every positive or negative experience that individual may have had with any other government agency. The message could be exactly the same from you or from us, but the person who delivers it is super important to influencing people's level of acceptance there. We've, as an agency, really have always relied heavily on our trusted community partners to share information and resources with our clients. But COVID fully magnified just how important that is. And out of that really terrible time came a really good two-way formalized communication system for helping, to really amplify key messages and information about services to the most vulnerable of our client population through a source that they and their families and their sphere of influence trust to receive accurate information. So if I could share just a couple of examples, there was lots of messages and tools available through lots of varieties during COVID. And I'm sure that all of even the real and legitimate information caused confusion. But because of the expanded connections with the provider community and with our community-based organizations, we created regular talking points that pointed to verified and validated resources, provided materials that could be used by, anyone and everyone to get a consistent message out. For instance, with winter virus, we created some social media tools in a variety of languages. We included the HCA logo in many of the tools because some of our providers say that including that did provide a level of validation or of truth. But others said that it didn't. And so we made the materials customizable so that if a partner wanted to drop in their logo, because that's what was trusted, then the flexibility was there to do so. We could provide images and text, and then whoever was using it could adjust it and use it as they felt was fit and would resonate with their providers. And the sensitivity and concerns are going to vary pretty widely by topic. I mean, for instance, children's vaccinations had to be handled much more differently than adult vaccination messaging. The push was really focused on education, and a lot of effort went into supporting and hosting webinars and town halls with trusted pediatric specialists who could address questions and misinformation directly to the listener. And we tried to make those available with interpretation in a number of languages with lots of different partners. We worked closely with Latina Health Access and some of the educational pieces that they were doing in AAP to just, as a community, stand together and share the same information, but again, from a source that was trusted. Mpox was another one. When it hit predominantly amongst the male MSM population, we worked with directly with our LGBTQ population collective of clinics and partners to publish the information about vaccination and treatment resources. And while we were the provider for test and treat and vaccinations, the messaging was coming from the appropriate partner who promoted the message, who were trusted and who had a direct line of connection to the intended target. The HCA platforms, we just reported the general information and prevention message. We didn't get into the details in the weeds to get the right message to the right audience. So again, it's like the information is going to be better received and acted upon when it comes from a trusted resource. So our goal is to just collaborate as much as possible with two-way communication to cut through the clutter and get the message to the right people from the right audience. So we'll continue to help draft text or share images and that let you all customize it to reach your target audience. And as Dr. CK indicated, rather than point to misinformation, we really just try and encourage people to educate themselves. And if we can help point them to those trusted partners, that's really our key goal.
Thank you so much, Julie. I love the examples that you provided. I remember as well how quickly we all recognized that we could not do anything effective alone, and we needed to really partner with all of our friends in the county and encourage them to do what they did best. And when we did that together, I think that's when we got the best results, for our communities.
Yeah.
Thank you, everyone. So I have a question for all of the panelists. And then I have a question from the audience. So first I'll go to the question for all the panelists. And as we conclude this segment, I would ask each of you to address what are 1 to 2 actionable tips that you can provide our audience with for mobilizing and building resilience against misinformation, and not only in the realm of community and public health, but also within our democratic process. And so I will start with Dr. Hoffer.
Okay, so I would say a low-hanging fruit or a less technical approach would be for to really develop question answer sheets, whether it's a healthcare organization or a community organization, even outside of health topics, whether it's about voter registration or voting but health topics, that if an organization can anticipate common questions and prepare answers to those kinds of questions, that can help everybody to avoid information voids, so to speak. I think when families or people's questions aren't answered, that they may then seek elsewhere for getting those answers. So that's as we're developing informatics tools, or we're building education programs, that is a low-tech approach for healthcare settings or community organizations to and try to anticipate and minimize information voids.
Great, thank you so much. Dr. Martinez?
Sure. I would say the most important thing to do from my perspective is to just take a pause. Let somebody tell you what they think. Give them the opportunity to be heard before you jump in as an expert. And then give yourself a pause to say, self, do I even know about this? Can I come off as an authority on this thing that maybe I've never heard before? And maybe I can say something to the effect of, oh, I've never heard that before. Wow, let me look into that, right? Because, as Dr. CK said, you come at people with negativity, doors closed. You lost me forever. And, an example here is I had a study a couple years ago on older Latina women who had first been diagnosed with diabetes in kind of later life. And I wanted to know about that initial diagnosis message. How did that come to them? And how did it influence how they worked with their provider from then on? And there were horrific stories, I will tell you, of one in particular of a woman who thought maybe this was the problem. She took the time to go online and research a bunch of things she wanted to ask about. And she showed up to her first appointment with this new clinician with this document. And as she was reading it, the person grabbed it and crumbled it up and threw it in the wastebasket. Was like, I'm going to tell you everything that you need to know about this. You need to trust me. I have a bunch of patients with good outcomes, blah, blah, blah. And I will tell you, if somebody did that to me, and I study this, you are never going to hear about the whole bag of Doritos I ate yesterday, right? Like, I'm going to continue to go to my appointments and I'm going to continue to get the meds and whatever, but you're never going to know about the reality of my life the second I step outside these doors, because you've lost my trust. Those doors are closed. That's it. And so I think it's important for us to pause and really listen to what people believe instead of assuming that they use this special keyword. So now I assume you're part of this camp and you have all of those thoughts and feelings. Give them a second to really explain where the vaccine hesitancy is coming from, for example. Be willing to legitimize what they did get right, because sometimes in that misinformation is the kernel of truth that got sort of morphed and became this hybrid truth that's not really true. And be willing to validate where that's coming from. But then also, like I said, give yourself a second and say, can I really talk about cinnamon in this case? And if I can't, instead of shooting it down, maybe say, that's really interesting. And I'm going to go look that up and learn more about it. Let me tell you a little bit about what I do know from my perspective that might be helpful. And then the next time we're together, I will have done some studying on my own, and then maybe we can talk about that. So I think we go very far when we validate other people's reality and we try to meet them where they are to determine what is their best version of their health. Now, I'm a nurse, which means we are not disease process focused. The field of nursing is holistic health. So I care about your mental, emotional, spiritual, physical health, death and dying, sexual health, everything, right? On your terms. And I've found it to be really helpful in this space and a real benefit for us using these interdisciplinary teams to address some of these very challenging things. Because I love my physician colleagues who can really get into the weeds on the disease process. And I feel very welcomed by them to also talk about the cultural influences or the family influences that may be driving the phenomenon we're concerned about.
Thank you. That's amazing. Julie?
I mean, I guess I would say as a communicator, right? I was sending out very highly medical information for a long time. And I have lots of friends who are like, are you a doctor? I'm like, no, right? So I mean, my best advice would be don't speculate about your health at a barbecue or a cocktail party, right? Actually seek information and look for credible sources. I think speculation and just bred so much misinformation and, that old game of telephone, right? Whatever you start with is going to be changed 1,000 times by the end user. And then things like, people misinterpreting using household products to care for their health, right? Crazy things can happen when you're not going to trusted resources. So, I mean, I guess trust but verify the people that you are getting the information from, right? And health is such a personalized thing that empowering people, giving them the information to make their personal choices and do the research is what we really seek to do as, share the information that that the health officer provides with her credibility and validation, share the information from the trusted community partners and point them to those community partners to get validated information. Just trust but verify and do the education to care for your own personal health.
Thank you. I love all the wisdom that's been shared today. Thank you all so much. I do have one specific question from the audience for Dr. Martinez. And the question is, what are your thoughts about the rampant misinformation about mental health and instant psychology that happens on platforms like TikTok and Instagram? How might we combat this sort of misinformation?
So I have a Gen Z kiddo, and that has allowed me to follow this probably a little more closely than some colleagues who don't. And wow, social media is the primary influence on at least my daughter and her cohorts' lives and daily experiences. And it is a benefit because they talk about their mental health. They recognize that there's such a thing as PTSD. They recognize that there is generational trauma. They get it. I would say, unfortunately, we opened that can of worms as a society without commensurate resources to address it. And we are now, as a health system, playing catch up for the folks that were like, you better get care, definitely seek care. Some sort of care would be good for you. You can have an appointment in 8 months. And bridging that gap between sub-hospitalizable concerns and I'm really struggling daily is a massive gap. Because if you need a 5150, sure, give me a call. But few of us are at that place right now, hopefully. And many of us are just beneath it all the time. And we really, as a society, have not collectively recovered from this major global pandemic that caused, at least for me and my community, many of us lost many people. And we are all still collectively grieving. So that's the one part of it. The other part of it is, this is a business, baby. Healthcare is a business, right? All of these little apps are businesses, and they're all situated within the capitalist structures that support all of us every day. And I find it very concerning when we roll out, big, huge projects or use this one mindfulness app, for example, without really evaluating the impact of those sorts of interventions across and within different communities who are also dealing with structural, historical divestment, and et cetera, et cetera. For example, I don't know how many people have seen this one study, but there was a study of pediatric residents who were under a lot of distress, and their university mandated the use of this mindfulness app that they were testing. And would you like to guess whether their well-being improved? It actually got worse, because it's just one more thing I have to do now. It's one more thing that you stacked on top when I was already really stressed. It doesn't mean mindfulness doesn't work. It doesn't mean mindfulness apps don't work. But it means that we as a society have to wrap our minds around the fact that there is no easy answer to the recovery that we all need, to building out what we want our society and our world to feel like over the next few decades, recognizing that we have all experienced varying levels of trauma and one giant collective trauma. So that was a very roundabout response. I hope I touched on some of the things that they were hoping to get out of that question.
Thank you, Dr. Martinez. I don't know if you answered their question, but you definitely struck a nerve with me in terms of the collective grieving that we're all doing. I think that we're all going to be experiencing that for years to come. And we don't know what all that is going to look like at the end of the day. And we definitely have to look to our young folk, right, to help teach us how to see the world through their lens, because I think the generational differences are allowing us to deal with that differently. And so I think that's right on. Thank you so much for addressing that. I think that misinformation is going to continue to come at us post-pandemic, even on the vaccine, debate. because a lot of information is coming out now, or folks' perspective on what really did happen to me as a result of the vaccine, or what really happened to me organically as a result of getting COVID. And I think we're going to be experiencing that for years to come. So thank you again for touching on that. I got another question from the audience, but this one is for all. And the question is, beyond traditional media channels, what innovative approaches or platforms have you found effective in reaching audiences with accurate health information? And how can we leverage emerging technologies such as virtual reality or augmented reality to enhance health literacy and combat misinformation? So I'll go back up to Dr. Hoffer to kick us off, if you have any input into that question.
Well, I would introduce, besides developing the informatics tool, I would say that there is a community care model, that I'm also part of, actually in South Los Angeles, about embedding, healthcare community clinics within neighborhoods, and the old school kind of spending time in the community, offering and delivering services within the community, from trusted people, and having more conversations. So there's just wonderful community embedded clinics where people still have really offer other things also, not just health fairs, health clinics, and other services that community folks need, and building and cultivating those trusted relationships. So that is, because the healthcare model is, unfortunately, well, it's wonderful, but it's not always tailored to patients' needs. You have to still navigate through all the different specialties. And so when you do have this community embedded, physically embedded models, where you bring services to the neighborhood at the neighborhood level, when it can be done, I realize it is more labor intensive. It does foster conversations and build trusted relationships. So that is independent of other traditional media channels. So that's one approach that I think works, and it can, part of the multiple steps and approaches.
Thank you, Dr. Hoffer. How about Julie?
Yeah, if I could build on that, that really goes back to, it absolutely reflects what I was saying earlier. It's literally going back to any book that ever talks about guerrilla marketing tactics, right? It is old school, one-on-one, 1-on-5, 2-to-2. It's personal relationships and developing that trust. And that was really been key to so much of the outreach that has occurred and that will continue to occur to tackle whatever the next thing that comes our way. That has been huge. The other piece that, from purely a marketing and communication standpoint, a couple of the programs that we've done, and I have to give a shout out to Univision. I'm sure we've done some things with other in-language media partners in the past, but they have been an amazing partner in customizing campaigns with us to utilize some of their trusted personalities to deliver the message. And that goes back to what we did during MPOX last spring to help avoid another big surge during some of the Pride events, to partner with a platform that was speaking to our community, leveraged a personality that shared lots of great tools and resources, who brought his personal experience, that sort of like implied celebrity endorsement. It wasn't even just implied, he was all in. Who would think you'd come out to a Pride parade and want to get a vaccine? But we went out prepared to vaccinate, thinking we'd get a small half dozen folks come by, maybe learn about it. And we had a beautiful display of all sorts of protective things too. We did 110 vaccines on the day of a celebration. It just really made a huge impact in having somebody that's not necessarily, that was a trusted partner that people recognized, and that, who It's not that we want necessarily, people taking medical advice from a personality, but it at least got them to listen, right? So that they could then go and do some research on their own and validate it themselves. So if we can get their attention in one way and then help get them trusted information. So we'll continue to look for and seek partnerships that will help amplify the message, whatever way is going to create some traction.
Thank you, Julie. Dr. Martinez?
I totally agree with my colleagues. I'm a super analog girl because I think that while at least our Hispanic Latino community is heavily social media savvy, especially for health information, for me, I want to capture the folks who aren't necessarily using that. So, grandparents and grandchildren who are early school age. So I paint murals a lot as an intervention for chronic illness, because folks who will not come to a diabetes education class will come paint a mural at their grandkids' elementary school on a Saturday and hang out with me and other clinician volunteers who are in overalls. And at that point, we can be kind of having some of those unscripted conversations that are trust building, but also giving you the information that you need. It's a perfect match for me here at Ultimate because they're very invested in using art and all sorts of fine arts and kind of non-verbal, non-auditory learning strategies to make sure that we get to where people are, both in the community and also in terms of their learning preferences.
Great, thank you. Thank you all. So this is a great conversation because we got one more question from the audience. This one is not directed to any one speaker, so whoever feels that you can answer this question, please jump in. The question is, what role does artificial intelligence, AI, have in spreading healthcare information? Is this a concern? And if so, are there examples of how health centers are combating this? Who wants to take this on?
Can I just say that AI doesn't naturally grow? It is created by humans that grew up with the same structural biases as the rest of us. And as we are seeing, all of these different studies are or actually just news stories about when AI was racist, or when AI assumed things about gender, or when AI disregarded certain things. AI is only as good as the information that we put into the system that it then organizes and extrapolates. It doesn't have original thought. So I work with a colleague who's actually in my postdoc who looks at how using AI in the emergency department may or may not address the pain management disparities that we see among African Americans, right? So I do think the reality is AI is us. And until we are a perfect society, we have to assume that it is going to mirror the things that we've failed at so far and create some stopgaps so that it doesn't expand on our own injustices in a way that is beyond our control or even visibility. So I think it's a wonderful thing, but I have a lot of personal concerns about how we build out the systems.
Well, thank you so much for that. Okay, that concludes the questions from the audience. Thank you all so much. Thank you to our esteemed panel of speakers for all of your insightful contributions and engaging discussions during this coffee chat. Your expertise has shed light on crucial aspects of our topic today. I think you guys touched on things that I, wasn't expecting. So I thank you so much for that as well. And building on the insights shared in our discussions, we're going to be moving into the final segment of our event. In this phase, we'll take a closer look at real-world examples of an organization that has effectively developed its capabilities and infrastructure to tackle misinformation. We'll specifically delve into how a community health center like Planned Parenthood has navigated challenges and explore their strategies for building and mobilizing resilience against misinformation. Please join me in welcoming Krista Hollinger and Nicole Ramirez from Planned Parenthood of Orange and San Bernardino counties. Krista Hollinger serves as the Chief Operating Officer for Planned Parenthood of Orange and San Bernardino counties, the second largest Planned Parenthood affiliate in the country. She oversees clinical operations for the organization's 9 health centers in the 2 counties, which provide reproductive health services and primary care 7 days a week. Krista has nearly 25 years of experience working in healthcare and public policy, including roles at UC Irvine Health and St. Jude. She earned her Bachelor's of Arts degree in urban planning and a master's in public health. Krista is a lifelong advocate for reproductive justice and access to high-quality healthcare for all. Krista today is joined by Nicole Ramirez, who is the Senior Vice President of Communications. Krista and Nicole, the stage is yours.
Okay, can you hear me?
Yes.
Great.
Yes.
Thank you. Thank you, Isabel, for that introduction, and to the coalition for inviting Planned Parenthood to be a part of this really important conversation. And I've just learned so much from our previous speakers. A little bit of a tough act to follow. Nicole and I were texting. We're gonna do our best, and a lot of what has been touched on so far this morning we'll be repeating some of it. And as Isabel said, what we're hoping to do is give some real life examples of what we've done at Planned Parenthood to combat misinformation. Okay. So a little bit about us for those who don't know. As Isabel did share, one of the stats that we love to brag about is we are the second largest in the country in terms of our volume. We have 9 health centers, 6 in Orange County, 3 in San Bernardino County. Last year, we provided more than 260,000 medical visits, which includes STI testing and treatment, cancer screening, birth control, abortion, pregnancy tests, emergency contraception. And then we also have our Melody Health primary care program. So we are really active with a lot of you all in the community for providing primary care as well. Our health centers are open 7 days a week, 10 to 12 hours a day, which we are really proud of. We've made a real intentional effort in the past year to expand our access on the weekends. So we have we see a lot of patients on the weekend, and they really express a lot of gratitude for us being able to do that. And we're really proud of, despite our high volume, being able to provide a really high level of care. Our patients are averaging in our wait rooms 11 minutes, and they are in and out of our health centers in less than an hour. And no one is turned away from receiving care at Planned Parenthood. Okay, so at Planned Parenthood, I know we were invited to participate in this because we know quite a bit about disinformation here. So while we are one of the most trusted names in reproductive health education and care, we're also a highly politicized organization, and where disinformation about us does run rampant, as you all probably know. So we're not only working to combat health misinformation among our patients, but we're also having to work to combat the external rumors, disinformation about our organization. And what we've really focused on, and what we're going to focus on for this presentation, is how we are doing that by creating a culture of high quality, compassionate, non-judgmental care. And really, the idea is to establish ourselves as a trusted resource of healthcare, but of information as well. And it seems to be working. If we listen to our patients, we have a 98% patient satisfaction score from our patients, and our Yelp reviews. All 9 of our health centers have at least a 4-star Yelp rating, which we're really, really proud of. Some feedback that we get on Yelp. I'll just pull out one of the reviews that we got here. This was my first time at Planned Parenthood, and the staff was very friendly, non-judgmental, and respectful. They answered any questions I had, and the facility was very clean. I would highly recommend to anyone. So disinformation and misinformation, just wanted to call out the difference between the two. And of course, for this presentation, we're going to be focusing on misinformation, but disinformation, intentionally spreading wrong information in a malicious manner, really the way to approach that, limit interactions. There's not really a whole lot that you can do with folks that are very intentionally trying to publicly do harm to your organization. Always respond with facts, and of course, then disengage. Misinformation, as we've been talking about this morning, is unintentionally spreading incorrect info. So what is really important with this, and we're going to talk about how we do this in our health centers, asking where folks have heard the information, correct the information with facts in a non-judgmental and clear way, as we've been hearing, and provide reliable resources for future use. So I'm going to spend a little time talking about what we're doing inside the health center, and then after that, I'm going to hand it over to Nicole, and she'll talk about what we're doing outside of our health centers to combat misinformation. So inside the health center, so we'll start with our mission statement as an organization. Planned Parenthood of Orange and San Bernardino counties provides an exceptional healthcare experience for every patient, protects and promotes the fundamental right of all individuals to make their own personal health decisions, advocates for and delivers comprehensive education to create healthier communities. So that first bullet, the very first line in our mission, is provide an exceptional healthcare experience. And we feel that it's really important to understand that for many of our patients, it can be intimidating for them to seek care. They may be inexperienced with the healthcare system. They may have been disrespected in the past by providers. And so really what our goal is to provide a really non-judgmental, respectful place where they've learned to completely trust us as a provider, and therefore the information that they're receiving from us, they'll be more likely to follow, and they'll trust that that is the right information, even if it may not be consistent with what they're reading online or, from sources outside of the organization. So our organizational values, we have something that we call the We Care, which stands for welcoming, equitable, confidential, accessible, respectful, and empathetic. And for us, everything that we do really starts with this. We share this from the very first onboarding, new hire orientation for all of our employees. We talk about this, what this really means, gives examples of this, and then it's an expectation throughout our culture. We have more than 550 employees here across our 9 health centers and education and our women's, infants, and children's sites. We have 3 of those. And our administration, this is an expectation, and when it's and we do a lot to show our appreciation to staff when they are exhibiting We Care, but it's really become an ingrained part of the way that we do business and provide care. We have We Care awards for staff, so staff can give them to each other. They nominate and provide them to each other, and then we give a large award at our annual employee appreciation events. It's a part of our performance evaluations. It's one of the things that all employees are scored on. And then they're on our badges. So it's a reminder to ourselves as we put our badge on every morning. And then, of course, our patients can see it as well. So I wanted to talk a little bit about the impact of language and literacy on health, and how important this is when we're thinking about and trying to approach how we deliver care, especially among our population here among the community health centers. I wanted to share the Healthy People 2030 study. That's a long quote, but I'm gonna try and speed through it quickly because I think it's really important what they summarized here. Quality of care is lowered when patients do not understand their healthcare providers, when patients and providers do not speak the same language, and when a provider's approach is not linguistically competent. Patients with limited English proficiency may receive lower quality mental health care due to inadequate interpretation services, as interpreters may normalize or omit pathological symptoms from their interpretations. However, trained interpreters and bilingual healthcare providers improve patient satisfaction, quality of care, and health outcomes for individuals with limited English proficiency. Overall, there is a need for healthcare providers and organizations to be more active in developing and employing strategies to meet the language and literacy needs of diverse populations, including via online and written communication. Next slide, and I'll then talk a little bit more about that. Just wanted to share this one study, and I do have the source. HHS had done this really interesting study among residents in San Francisco, English speaking, Spanish speaking, and Chinese speaking. And the results showed that 82% have reported at least one negative health information seeking experience. Chinese language was associated with frustration. Difficulty understanding information was more likely in Spanish language respondents. And participants with limited health literacy reported more effort, frustration, concern about quality, and difficulty understanding information. So that, I think, is really important, and our previous speakers touched on this as well, is really meeting our patients where they are at, from a language perspective, from a linguistic competency perspective. Again, one of our speakers gave that a great example about cinnamon, and how, all of us as patients are coming with our own social experiences, cultural experiences, our own biases, and all of that. And we have to recognize that when we are delivering care. So part of the way that we have done this at Planned Parenthood is hiring a bilingual staff. And this is actually a priority for us for recruitment. So we have one health center, for example, that has a very large Spanish-speaking population of patients. And when we've had some openings, when we've had staff leave and they have been bilingual Spanish English speakers, when they've left and we've had to replace them, it has sometimes taken us longer to fill that position if we cannot find a staff that speaks Spanish. But we delay because the hiring, because it is super important to us that, that is a really critical skill set that we're looking for. And we pay a language differential, and then we use an external vendor for a bilingual test. So again, we might have a lot of applicants actually who speak Spanish, but when they go through that test, they don't meet the minimum score that we have set for depending on the position, whether it's a front office staff or a clinician or a medical assistant. It's a different test. The level of Spanish that they would speak, or Vietnamese for our Vietnamese speaking bilingual staff. And if they don't meet that, then unfortunately they don't meet the criteria and we can't hire them. It can sometimes on the hiring side be a little frustrating, but overall, long-term, it's really important because it's such a priority that our staff are able to communicate with our patients. We do utilize a translation service because we have a number of patients. This was actually surprising to me. Our translation service has phone and video capability. But what surprised me is I asked the team, how many languages do we provide translation services for? And I was shocked. It was 45 languages. So we have patients that come in that are speaking 45 different languages. And fortunately, we have access to the translation service that can provide that. And then in our printed information, which Nicole's going to touch on a little bit more later, it is available in multiple languages and is created at a lower literacy level. So the other part of it that we are doing is really embedding this in our training on customer service for all of our new healthcare staff, our managers during new hire orientation, and then we do ongoing annual trainings as well. And I'm going to show a few slides from our training that we provide. But we're really training our providers to use evidence-based care driven by nationally recognized guidelines. We always ask if everything is clear and if there are any questions. We answer all questions in a clear and non-judgmental way. And I really highlight the non-judgmental part of that. Recommended trusted websites like for us, ACOG, the Mayo Clinic, AAFP, Bedside.org, etc. And then we discourage Google or social media searches for information. I know we all do that. Really, for us, we think about how, when patients seek us out with their healthcare questions, the idea is that if we're really trusted, we're going to have better compliance with our treatment plans, better compliance with our disease prevention tactics that we're giving them and advice that we're giving them, and ultimately better health outcomes as well. So here's an example of a slide that's part of our customer service training for our new staff. So why customer service is integral to providing healthcare. Many patients are seeking care from a very vulnerable place, as I mentioned earlier. Therefore, it's really important that patients feel that all their questions and concerns are not only heard, but understood and addressed. A patient's healthcare journey is lifelong, as we know. Therefore, it's important to make that experience one that is as pleasant and smooth going as possible. And ultimately, all patients want to feel seen and cared for. And so again, this is one of our training slides, so that right off the bat, when employees are coming to work with us and they're going to be in our healthcare centers providing care, that we're sharing with them that this is how we view our role in providing care to our community, and how important it is to meet patients where they're at, and to understand that when they walk through our doors, they are coming to us, especially in our health centers, when they're coming for reproductive health services, that they're coming to us a lot of times might be feeling shame, might be really scared that they're going to be judged. We actually get Yelp reviews where patients will say, I was really scared. I thought everyone would judge me for coming in and seeking these services, but everyone, was so nice and non-judgmental and so respectful. And we just light up when we see those reviews, because for us, that's what it's all about. And then this is another slide as part of our customer service training, where we give the staff, and then we do a whole exercise around this too, but pointers for being responsive. When a patient expresses a need, acknowledge what was said. Repeat it back to them in your own words. And some examples. Okay, got it. So you would like, do I have that right? What I'm going to do first is, so always communicating to patients sort of that agenda setting. I'm going to listen to your heart now. I'm going to do this, communicating that. I hear you. It sounds like you need, is that what you need today? I will go ahead and inform, etc. And next slide, a little bit more examples that we go over with staff, pointers for giving off warmth. So wait for natural pauses in the conversation to speak. Let the patient know you understand and you feel for them. Do not insert any of our own opinions into the conversation. And I know we talked a little bit about that earlier, and so important to just show up and be in that space to hear patients and be able to pivot and respond to what it is that they're asking, or what it is that we can see that they're trying to communicate to us. So we give our staff examples of things to say. I hear you. I understand where you're coming from. I am sorry to hear that you're experiencing that. I'm here for you. How can I help? Can I get you anything? And one example I wanted to give, we have what we call our Everybody project. So we've taken the initiative to make our spaces, our culture, and our strategies for care more inclusive for patients of all body sizes, so that everybody is welcome. And these are some of the things that we've done. Our health centers have been equipped with medical equipment that is suited to all body sizes. We have gowns that are suitable for all body sizes, blood pressure wrist cuffs suitable for smaller bodies, blood pressure arm cuffs suitable for larger bodies, various sizes of speculums, and scales that are suitable for all body sizes. One thing also is our scales do have the capacity to just send the data directly to our medical record. And that was really important for us, because there's always can sometimes be that awkward moment, where the patient gets on the scale and the medical assistant, is looking at the number and writing it down, but this, it just immediately directly goes to the medical record. But this was an example, we wanted to share it, of how we've trying to create that culture so that every patient feels welcome, and that we're really listening to what their healthcare needs are, what that experience would look like for someone coming into our health center. This was really sort of brought back to us by an administrator who had on their executive rounds had gone through our health centers and observed a larger patient had come in and didn't really have a chair to sit in that was comfortable. And then as we were exploring and started to realize, like, oh, we are not actually really set up for those patients, and we need to be. Let's see next. And I think this is where I hand it off to Nicole.
Great. Thank you so much, Krista. I appreciate it. And thank you, Isabel, for having us here. This has been wonderful. Thank you so much for the speakers. It's been great listening to you all and learning from everyone. And I also just wanted to say thank you to everyone out there. I know you're all doing some really great work with the communities, our vulnerable communities, and just want to appreciate everything that you're doing for them. So thank you all out there. I'm Nicole Mears. I head up the communications and fundraising for Planned Parenthood of Orange and San Bernardino counties. And so as Krista was talking about, there's multiple ways that we're really working hard to create this culture of care. And it starts at the very beginning from when a person is looking us up on the website, making the phone call into the call center, all the way to when they first walk into one of our health centers. So we're taking every opportunity we can to educate. And that could be as soon as they walk in, we have waiting room posters that will educate about, it could be different things that are going on in the community. It could just be honestly about STI tests, ensuring you're getting tested. We also have waiting room digital signage. So it's, just the quiet kind of almost like a PowerPoint slide that goes through. And here I just gave an example of yeast infections symptoms. It allows for that 11-minute wait time. We figure people can either be on their phone or maybe they take a quick look up and learn a little something as they're getting ready to come into the health center. And then once they're in the exam room, we also have communication there as well. So we're essentially taking every moment that we can to teach them. And then extending it to the actual visit. So that should say tools used during visit. Sorry about that. But we've created multiple different tools for providers to use when they're speaking with the patients. And as Krista had said, every tool that we're creating is really, we're trying to make it as easy to understand as possible, lower literacy level, using a lot of images, and just making it very, very clear. And of course, in multiple languages. Our patient population is generally English, Spanish, and Vietnamese are the three highest. So we have all of our tools in those three languages. We've also started creating for procedures like miscarriage support, abortion care, and vasectomy. We have animated videos. And what happens there is that prior to having the procedure, they'll watch this video, and that will then provide the opportunity for education. And then it also allows them to kind of think about questions that they have for the provider prior to anything happening. So these have been going really well for each patient right before they come in to just ensure they understand exactly what's going to be happening. And then, of course, we have educational outreach brochures on a wide variety of services, different education, and those can go out in the community. We also have them in the health centers as well. So then kind of moving outside of the health center, and as I had mentioned, really trying to focus in on meeting the patients at the very beginning. And that, of course, starts off with our website. So we're very lucky to be part of a larger federation that the website has tons of great information on, PlannedParenthood.org, and really lots and lots. I would say like, I'll get guested, hundreds of thousands of people go there every day to learn. So our part of the larger federation at Planned Parenthood of Orange and San Bernardino counties, we averaged closer just under 200,000 visits a month, which is still really good for us. And every time that we kind of think about what this looks like, how we're designing it, we're realizing that, or we're focusing on it being mobile first, right? Because we know our patient population, our 18 to 35-ish year olds, are mostly looking at and searching information on their mobile device. So it's incredibly important that anything that you have online is first developed with mobile first, and so that everything looks good on mobile and then potentially on the laptop. We're also making sure that everything is simple, very simple language, making it nice and clear. Again, the whole goal is that literacy and that the patient truly understands what's happening. I also put in here Spanish language. We do have a toggle button for folks who would like to have everything in Spanish. Interestingly enough, I just looked it up. It's only 1.5% of our total visits are toggled over into Spanish, but I do think it's an important piece to have for those folks who are monolingual, so that, again, they know exactly what's going on and they're getting that education that they need. And then I know Dr. Martinez talked about this, and that Gen Z population, right? It is right on. So we try very hard to focus on meeting our patients where they are, and that's on social media. And as she had said too, we found 42% of Gen Z, which is 11 to 26, they're relying on social media to get medical information, which is just mind-blowing to me. But I also just had to add in there 60% are getting news there, which is even more mind-blowing to me. But that's where they are. And so that's where we need to be to help not even combat misinformation, but to provide honest, accurate information as well. And so we have a team that works on our social media. And some things that some kind of tips on this is, pushing content out consistently. It's like a daily thing of pushing out education, staying on trend. So it's important that, you're not pushing out information or honestly, to get that Gen Z to paying attention, it has to either have the video or the right music that's in trend right now, or, whatever the cool video look is. So you have to make sure that you kind of know what's going on there. Video has been very big. They're paying much more attention to video than just those static images. And then it's incredibly important to understand where your audience is. We could just say social media. That's a huge, broad array of things. But your target audience on TikTok is very different than the folks who are on Instagram and especially on Facebook. So, and then of course on X or Threads or whatever you want to call it, formerly known as Twitter. So we're finding a lot of our patient population is engaging more with TikTok content, those like shorter videos. And then a lot of our folks who are more supporters, who are maybe older in their 40s, are more on Facebook. So again, you have to really tailor that content depending upon what type of information you're looking to get out there. So for example, we might talk a little bit more about vasectomy or IUDs with a Facebook crowd, right? So those types of things. And then we're very, very lucky because we have an amazing community health education team. We have a whole group of folks who are essentially experts in health education. And so, of course, they're going out to health fairs and community events, but we realize that another way that we can utilize them in a really great way is using them on social media. So we kind of use them as our influencers. And so they work with us to create that content, since we need to be pushing it out daily. And they're the ones who are really helping us educate our patients and just overall the population. So I'm going to see if I can actually get one of these to play. So we're going to, if you all can hang in here with me, we'll see if this will actually work here. Okay, are you able to see this?
I had an STI, I didn't even know it. I went in for my annual exam recently, and the doctor recommended a routine STI test. I didn't really think too much of it, but to my surprise, I ended up testing positive. I thought it was super weird because I hadn't experienced any symptom. But the doctor told me that the most common symptom for an STI is no symptom at all. The good news is that most are easily curable with medication, and all STIs are treatable. I'm sharing my experience because there's still a lot of stigma surrounding STIs. But I'm learning they're actually super common. About 1 in 5 people in the US have an STI. And 18 to 25-year-olds make up about 50% of all new infections. Moral of the story is, get yourself tested, even if you don't have things.
So that's a good example of utilizing one of our health educators. And that music in the background was part of some type of trend at the time. So it was trending on TikTok and it worked really well. And as you can tell, he is educating as he's kind of talking and doing whatever that trend is as they're sitting in the car. And then I'll just share one more example here.
Someone who knows a ton about birth control, I thought I'd just knowledge about the many options that are available. First up is the birth control pill. It's widely used. It's actually 99% effective when taken every day at the same time. Next are IUDs. These are small tissue devices that are inserted into the uterus and last for years at a time. With over 99% effectiveness against pregnancy, these are a really great option for someone who doesn't want to become pregnant anytime soon. Another long-lasting, highly effective option is the implant. It's a small rod that's inserted into the upper arm and lasts for up to 5 years. It's also a hormonal patch, so you can wear like a bandage on your skin. You just stick a new one on your skin once a week for 3 weeks on, 1 week off. Then it's done with that. This hormonal method requires someone to get an injection every 2 weeks. The thing is small and flexible on one side of it. It's about every week, depending on what's your needs. All that and more are able to little to cost in your local clinic.
Sorry about that. Let me jump back over to the other screen here. And again, as we were talking about understanding which audience that you're speaking to on different platforms, there's also a different style that is important to keep in mind. So TikTok is definitely more of an organic style. As you can tell, it looks like they just kind of put up their phone and did the video and put some music behind it. You'll notice that on certain platforms, the folks will be looking for that type of content over what I'm about to show you, which looks much more polished. And you can essentially tell that it's more of an ad in a way. So it is, again, important that even if you're just putting out information, like honest, accurate information on social media, that is incredibly helpful. Just getting that information out there so that when that Gen Z is looking for it, it's actually there. So let me try this one more time of sharing, see if this one works.
Make myself ready to celebrate. Getting older, there are lots of reasons for my girl and trying to avoid pregnancy. Maybe you need help with the medical problem.
All right, sorry about that. That one's not going to work. We'll go back. But again, I think obviously the overall idea is that there's multiple different ways that you can be pushing out this content on different social media platforms, understanding who your target audience is. I think the most important part is to actually just do it and ensure that that education is out there. And another quick example before we wrap up to ensure that there's any questions that I wanted to share is doing this also in a way, kind of, I would say almost more old school with blogs. So we had this, it was right after the Roe v. Wade was overturned, and there was a big concern coming out about period tracking apps and, who has my data and who's tracking me and what's going on. And so what we decided to do is in a very timely fashion was create a blog, put it up there that tells you how to track your period without using one of those period tracker apps. And we pushed it out on our website. We pushed it out on social media, kind of linking everything. And it's actually turned out to be a huge, a really great blog for us. So 85% of people, there's over 50,000 page views, and 85% of them are coming from Google search, meaning that they're literally typing in, how do I search or how do I track my period without an app? And then one of our web pages is showing up. So then that just demonstrates the ensuring that people understand Planned Parenthood is a trusted source of information if we're coming up, 1 and 2 on Google searches. And then it's also a way to get out that honest, accurate information. And so all of these are really intended to create that culture of care, to create the idea that people can trust the information that's coming from Planned Parenthood, and hopefully to get the right information in folks' hands. And with that, I will stop and see if there are any questions.
Thank you so much, Krista and Nicole, for sharing your expertise and knowledge today. I don't see any questions come up. Your presentation today on strategies and approaches to mobilize and build resilience against misinformation at a specific community health center were insightful and actionable. Thank you again for your participation. Let's see now, as we draw our Coffee Connections event to a close, I want to extend my heartfelt gratitude to each and every one of you for your active participation and thoughtful contributions throughout our discussions on Truth Matters, building and mobilizing resilience against misinformation. Thank you to our esteemed speakers and our audience. Today, we've explored critical importance of confronting information head on and the necessity of fostering resilience within our communities and our organizations. We heard inspiring insights, shared valuable strategies, and learned from real-world examples of organizations like Planned Parenthood that continuously combat misinformation in their work. I'm going to go through a series of takeaways that I picked up based on hearing and listening to each one of our speakers, just as a high-level review, again, of our content today. So Dr. CK started us off this morning, and she reminded us that during COVID, we were not only fighting the pandemic, but we were fighting the information age infodemic. She shared that the Surgeon General, Dr. Vivek Murthy, realized the significance of misinformation and urged Americans to help slow the spread of health misinformation during the COVID pandemic and beyond. He shared that health misinformation is a serious threat to public health and can cause confusion, mistrust, and harm people's health. She was able to help us create a common language and understanding around mis, dis, and malinformation. Misinformation is untrue or false connections, while disinformation is part of misinformation and is false context or manipulated content. Dr. CK also shared that once people have heard misinformation, they tend to believe and act on it, even after it's been corrected. Often we as a society take shortcuts and we don't validate information. And as such, she shared some key tips, such as understanding the psychology of how people validate the information presented to start to counter it. To learn about the other side, she stressed that we need to listen with empathy and ask questions. If any of this isn't followed at the onset of the discussion, we will lose trust with the individual. During the moderated discussion, Dr. Hoffer also shared it is important to focus on enhancing surveillance of online misinformation, so we can avoid it by developing tools where we can predict the kinds of health misinformation coming down the pipeline. By doing this, we may have more time to be able to prepare and possibly inoculate and give people warnings about misinformation. Dr. Hoffer also stated that we need to combat misinformation on multiple levels, from technological approaches, legal and policy approaches, to educational and psychological approaches. Then Dr. Martinez shared that when talking about mental and behavioral health, but more specifically, she stated, we're talking about the crisis, which is where we see the primary impact of misinformation and disinformation. We're dealing with stigma and why stigma exists as a protective mechanism. Dr. Martinez also stressed the importance of respecting people's values and beliefs and meeting people where they're at. And she highlighted that we're still in a collective grieving process over the pandemic and still learning what that lasting impact will be. Julie shared that we can't do this alone. We're only effective to individuals that trust us. She shared that as a government agency, their audience can often be polarized. And as such, the message can be the same from HCA or others, but it really comes down to who delivers the message. Trusted and appropriate messengers are key. Information better received and acted upon when it comes from the right groups. So the healthcare agency is working to share information with the community rather than point to misinformation, encourage people to educate themselves. And if we can help, point individuals to the right information. Speaker tips that were shared were the following. A low-tech approach was shared, and this is the development of a Q&A sheet where it is a healthcare org or community, whether it's a healthcare organization or community organization, whether about health or voting. If an organization can anticipate common questions and prepare answers to those questions, this can help minimize or avoid information voids. When people's questions aren't answered, they will seek another place to get those answered. Dr. Martinez reminded us to take a pause and let someone tell you what they think. Give them the opportunity to be heard before you pump in as an expert, but also give yourself a pause to ask yourself, do I know about this and can I be a voice of authority? And if I don't, it is okay to take a moment to say you don't know, but let me look into it. She emphasized the need to pause and listen to what people believe. Give them a second to share so we can understand where their beliefs are coming from. Give them credit for what they got right. We go very far when we validate other people's reality. Julie stressed to not speculate about your health in settings such as a party and seek information and look for credibility. Trust but verify the people you're getting information from. Health is such a personalized thing. And then we moved on to Krista at Planned Parenthood, who shared that what they're doing inside their health center, starting with their mission statement and organizational values. She shared it is important to understand for many patients, it can be intimidating to seek care. Therefore, the goal is to provide a non-judgmental, so respectful place. This starts with the mission statement and org values. Krista spoke about the importance of designing a system that can appropriately care for the patients served. And this includes ensuring that bilingual staff are hired, translation services are utilized for as many languages as possible. She also spoke about the importance of embedding standardized training on customer service and training providers to use evidence-based care driven by nationally recognized guidelines. She shared if an organization is really trusted, that will translate into better compliance and health outcomes. Nicole then spoke to us about what is being done to external to the health center. She shared to create a culture of care. It all starts at the beginning, from looking a health center up on their website all the way to walking into the waiting room. Nicole reminded us to meet patients where they are on social media. 42% of Gen Z rely on social media to get medical information. She shared we need to be on these sites not only to provide information, but to combat misinformation. Therefore, it is important to push constant content out consistently, stay on trend to get Gen Z to pay attention. Video is more important than static information, and need to know where your audience is. Audience on Facebook, for example, is very different from the Instagram and different from TikTok platforms. In addition, to circle back to my initial comments, please remember to make your voice count this upcoming March 5th and vote. Consider your sources of information. Ensure that any voter guidance you may be reading is from a trusted source that has a public health and accurate information at the forefront. As we leave this event, let us carry forward the momentum and commitment to truth and integrity. Let us remember that our collective efforts are vital in safeguarding the well-being of our communities. I encourage each of you to continue this conversation that we had today, implement the strategies discussed, and remain vigilant against misinformation in all forms. Together, we can create a more informed, resilient, and empowered society. I also wanted to share that the coalition is now a part of the My Vote, My Health campaign, launched by Ultimate Services and supported by the California Primary Care Association, focused on building capacity and engagement amongst health centers, health advocates, and the community. Feel free to follow at My Vote, My Health on social media to learn more about this amazing work, as well as the Coalition LC, where as the election approaches, you'll see content to encourage us to vote. Thank you once again for your dedication and participation. You will receive a follow-up email with material today and the link to the recording, along with a quick evaluation. We look forward to seeing you all at our next Coffee Connection event scheduled for July 4th, 2024. Thanks again, everyone.